Good morning. I'm Phil Mendelson, Chairman of the Council. This is a joint press conference that I'm having today with the Mayor. As you know, the Mayor has been doing daily briefings, and so she will be reporting some of what she typically reports after I'm done speaking. But as you know, or many of you know, on the day before a legislative meeting, I have a press conference. We thought it was easier for all of you if we combined the two press conferences rather than make you travel and be the only travelers on Pennsylvania Avenue between here and the Wilson Building. So this format today is a little different. I'm starting off and I'm going to talk about tomorrow's legislative meeting. Tomorrow is a regular legislative meeting. The council meets on the first Tuesday of every month. It will be our 27th legislative meeting of council period 23. The agenda is somewhat limited. I have indicated to council members that while we are trying this new having a virtual meeting where members are participating through electronic platform, that we have to limit our agenda. It's hard for us to circulate items at the meeting, so documents to be considered tomorrow have to be filed today. In fact, filed no later than this afternoon. So we are going to dispense with the usual introductions tomorrow. We're not having any ceremonial resolutions. We're dealing with final reading on bills that have already gone through first reading and were not controversial. And we have some contracts that the Mayor had submitted. I believe all the contracts are related to the emergency, as in increasing the financial authority under the contracts. I believe they were under $1 million, and now they'll be over $1 million in terms of not to exceed. That's with regard to the contracts. There are a couple of bills that were not controversial but are on non-consent just because there'll be some amendments. So really where the action is tomorrow is on the emergency bills before the council. There's a bill dealing with Children's Hospital, which is really just extending some authority that was previously approved in an emergency. There's a firearm safety omnibus clarification bill, which at the moment I don't remember, but it wasn't controversial. I believe, again, it is a basically extending an emergency already approved. And then there is the COVID-19 Response Supplemental Emergency Amendment Act. And that's where most of the attention has been and will be. Let me speak to the highlights in that emergency bill. It's doing many things. There are about 37 sections. I'm not going to go through all 37, but I will welcome questions if there are any regarding different sections. First of all, what the bill will do is extend the Mayor's authority with regard to declaring the emergency for a full 90 days, that is until the middle of June. The law, I believe, says that the Mayor has 15 days and then has to come to the council. On March 17th, we expanded that, I believe, to 45 days. Now we're doubling it to 90 days. So she will have that authority until mid-June. The bill also will authorize up to $500 million in short-term borrowing. This was requested by the Chief Financial Officer, and Jeff DeWitt is here. And I neglected to note, in addition to the Mayor, who I assume is standing behind me, that Councilmember McDuffie, who's the Chair Pro Tem, is also here and available to answer questions. The district is in a good financial position, so we are not worrying about whether we have revenue, although we are seeing a substantial reduction in our revenue this year. And if there are questions about that, I'll let Mr. DeWitt answer that. But we are concerned that because we are dipping into our contingency funds substantially, and just because of the way cash flow works, that there could be a dip greater than we have experienced in the last few years in August. And so this legislation authorizes short-term borrowing, much of which would be repaid before the end of the fiscal year, and the rest would be, I think, about 1 year. A line of credit with banks. So that is an important feature of this legislation. There is a provision in there that authorizes the Mayor to provide up to $25 million in, I believe it's in grants to hospitals to help with their costs as they prepare for the surge. We do expect that this money will be reimbursable from the federal relief legislation that's been adopted. But to ensure that those dollars are available now to help hospitals, that's in this bill. There are several consumer protections in this legislation concerning funeral homes, civil rights, and debt collection. With regard to debt collection, to hold off on seizures and to also limit how collections are made. That's concerning consumer protections in the bill. There is in this legislation a rent freeze that will be citywide. It will affect both rent control units and non-rent control units. In other words, all units during the emergency. That rents cannot be increased during the emergency. There's also a provision concerning mortgages that if an individual can show that he or she or a business has reduced income because of the emergency, that or illness, we're talking about individuals, that mortgage companies have to offer a 90-day deferral. And for commercial tenants, if there's a mortgage deferral, that has to be passed through to the commercial tenants. There is in the bill a provision for expanded use of individual opportunity accounts. That's intended to allow more financial flexibility for individuals because they'll be able to access those opportunity accounts if they have them. There are provisions in there that make adjustments to the unemployment insurance and our safe and sick leave laws to conform with the federal CARES Act. And that includes, with regard to safe and sick, that businesses with employees between 50 and 500 have to provide up to 2 weeks safe and sick leave to their employees. There are a couple of provisions aimed at reducing the jail population, and I'm including within that Bureau of Prisons. We don't have authority over the Bureau of Prisons, but we do have authority over sentences. And so this bill expands good time credits and also provides for compassionate release as strategies to reduce populations of those who are incarcerated. And there is a couple of provisions in there dealing with graduation requirements from schools, waiving the community service hours requirement for seniors. Currently, seniors are required to perform 100 hours of community service, and if they hadn't by the time this emergency began, we assume it's difficult for them to do it now. So there's a waiver of that, as well as the in-seat attendance requirements related to Carnegie units. And then I believe finally on the bill, there's some provisions dealing with the elections to ensure that the Board of Elections has the flexibility in the law to encourage and to encourage as many DC voters as possible to vote by mail in the June primary and the June special election. This bill that I've just discussed is a consensus document. We had a conference call, a very long call, on Saturday, the mayor, myself, the chief financial officer, the attorney general, to discuss all of the provisions in the bill. And what I've outlined, it reflects a consensus. Prior to that, what my office did was it made it clear that we would collect ideas from council members, from the mayor, from agencies, from the Attorney General, from just various sources. And all those were put into a draft that was circulated on Thursday. That draft was refined somewhat and circulated again on Friday. But the discussion, the meeting on Saturday, is where we got to the consensus building. So there were some provisions, I think there were about a half dozen sections that were taken out after as a result of the conference call. And we were looking at the different proposals with an eye toward their costs, the need related to the emergency, and whether there were possible unintended consequences. Most of the sections stayed in, but as I said, about a half dozen were taken out. I want to note that the mayor was unenthusiastic about some of the provisions. I disagreed with some of the provisions that stayed in the bill, but this is a consensus document, and I want to emphasize this point that all of the elected officials recognize that this is a time when we need to be working together and as much as possible being on the same page. So the bill reflects that. The legislation was recirculated on Saturday night, reflecting the broad changes that were made, a couple of additions, and as I said, some sections that were removed. We are still going through the editing process even as I speak now. We're confirming legal sufficiency as well as cost. So my staff informed me there might be a provision in there that will come out because there's a question as to its legal sufficiency. So there's still some refinements being made. The bill was circulated Saturday night and again yesterday and will be circulated in a couple of hours. And it's my intent that what's circulated in a couple hours will be the final version. I do know that there's been some attention to the issue of what we are doing for undocumented residents of the district. There was a provision that was put in on Thursday, and when we looked at it over the next couple of days, it was clear that there was a fiscal impact to the two provisions. One was a parallel UI process for undocumented workers, which was estimated to have a cost of about $33 million. And there was another, which was a grant program for individuals who are undocumented, primarily undocumented, and that had a estimated cost of $42 million. But it was clear among all of the participants in the call that this is an issue that we continue to look at. And in fact, I expect there'll be some more discussions today regarding that. I think I can speak for other elected officials that we all want to address this issue, and that is the undocumented who are probably getting the least relief between the federal legislation and what we have adopted already. They're not benefiting from the $1,200 payment from the federal government or the $600 per dependent. They're not benefiting from a number of the different benefits that the governments, local and federal, have identified. And so we're committed to continue to work on this issue and see what relief we can provide. If not tomorrow, then as soon as we can thereafter. So that's a quick run through of the meeting tomorrow. The meeting will be virtual. I believe the press has been informed, and one can go to the council's website to learn how they can access the meeting. We're doing our best to conform with the open meetings law. So members of the council and the officers will be able to participate, and others will be able to attend this virtual meeting. And again, go to the council's website to get the link. The meeting will begin at 10, and I assume it will be completely awkward because we've not done this before. We had a practice meeting last week. There were a couple of reporters on the line who found some of it funny because it was funny, because we're struggling to learn how to raise our hand on a virtual platform. But we will get to that meeting tomorrow and be and open to the public in that. I believe the mayor has some remarks to make, and then we'll take questions.
Thank you, Mr. Chairman, and thanks to the members of the council present and also participating virtually. I want to acknowledge our Chief Financial Officer has also joined us, and I will provide a quick update. And as you heard from the chairman, we are certainly have put our city in the best position financially to respond to a global health pandemic that is having far-reaching impacts on the district's finances. And it is incumbent upon all of us to continue to make great decisions, to continue to look forward to how the district will recover from this. We already know that we will need to cut $607 million from our current fiscal year that ends on September 30th. And I am working with my entire cabinet to make sure that we are achieving every efficiency that we can in our current operations. So today I signed a mayor's order that freezes hiring, salary increases, and travel at DC government. Exceptions will be limited to the coronavirus response and public safety, human services, and staffing for our schools. And just as residents and businesses are making tough choices, the district will make tough choices too. And to that end, we will be having a more formal briefing later in this week on Wednesday, where we can discuss all the local and federal programs and different changes that affect personal and business finances. I want to turn to now reporting on our case experiences with COVID-19. And certainly our thoughts and prayers are with everyone who is suffering with COVID-19, recovering with COVID-19, and those families who have lost members of their families. Today, we report 1,097 confirmed cases of COVID-19 in our community. And tragically, we report the loss of 24 D.C. residents to COVID-19. This morning, we also began releasing some of our data broken down by race, and our intent is to share as much information as we have and as we can. With community spread underway, we cannot express enough that staying at home is every individual's responsibility to save lives. On Friday, the CDC issued a recommendation for people to wear masks when they are in public. And I want to be very clear about something. Wearing a mask does not replace social distancing. Everyone should continue to stay at home except for when they are engaged in essential activities. However, when you do leave home, it is recommended that you wear a mask, and guidance on wearing masks is available on coronavirus.dc.gov. So with that, I'll turn back to the chairman for questions.
Thank you, Madam Mayor. Are there questions? Martin.
Just starting off on the two provisions you mentioned regarding excluded workers and how they would access potential benefits. I mean, you said that there's a big expense attached to it. Folks are saying that Montgomery County has a smaller program. I mean, are you thinking of trying to create some sort of smaller program that they could start drawing money from, whether it's run by the city or a nonprofit? Like, what are the ideas you guys are tossing around to help undocumented and workers that are in the non-traditional sector?
Well, it's premature for me to say too much because I have not engaged in discussions with the mayor and her folks. What we looked at was what was in the bill, which, as I said, was a parallel unemployment insurance system. These are undocumented workers who haven't paid into unemployment, but perhaps their employer did. They're not, so I misstated there, that their employer may have paid into unemployment, but because these are undocumented, they can't access UI benefits. But the parallel system was estimated to have a $33 million increase. And then we looked at the microgrant program. I think it's worth our taking a closer look at what Montgomery County did. I had a conversation with a labor leader yesterday who said that they were doing some research and looking at what some jurisdictions in California did. I can't promise that this will be in the legislation tomorrow because basically we were at pencils down yesterday. But there are some strategies that I think we should continue looking at. And I want to emphasize that in the conference call on Saturday with the mayor and the other elected officials that we all agreed that this was a challenge for D.C. residents, a certain segment of D.C. residents that we want to try to help.
Can you explain, as far as this legislation is concerned, you went through a lot of what was in there. As far as the relief for undocumented immigrants, is that something that is now separate from that bill that you were discussing? Or are you voting on everything that's already in the bill and then this undocumented relief issue is something separate?
If I'm suggesting that there'll be a separate piece of legislation tomorrow, that would be incorrect. But what I am saying is that the way we left it on Saturday was that we would continue to look at this and see if we could find a solution. Tomorrow's not the last meeting of the council, and so there are other opportunities for us to address this, even though I recognize that the need is urgent and that days are critical to some families. Weeks certainly are more problematic. So I'm not giving you a definite answer on timeline because I can't. And I'm not giving you a definite idea on where we're going because I can't. Just want to make clear that the door is open between elected officials. We were very clear about this in the call to continue looking at this. Sam.
Yes, Mr. Chairman, I'm asking questions for a colleague that's working on something. He's talking about your plan to help landlords and tenants with mortgage and rental relief. Are you able he wants me to ask you what happens after a 3-month period when people don't have to pay? Will mortgage companies ask for a balloon payment? And if so, will the balloon payment then be forwarded over to renters, or does it just get tacked on to the end of the mortgage?
There was a lot in that question, Sam. So there's a provision in the bill concerning mortgage deferral, and that is available to on both the residential and the commercial side. We looked at the language, and I've not seen the latest revision. This is an example of where there are continued refinements. We do not want a balloon payment at the end of the period. And what we really want is for a negotiation between the mortgage holder and the debtor. We are clear that on the commercial side, that if there is some savings, that the tenant has to benefit from that. We have separate protections in the bill with regard to, and the previous legislation with regard to residential tenants. So we have the rent freeze. Rents cannot go up. And as you know, we've done quite a bit already with regard to assistance to individuals. The federal law is like, $1,200 per individual? Anybody who was employed who's now unemployed has access to unemployment insurance. So the income is still coming into individual residential tenants. So the treatment is a little bit different. But the part of your question dealing with balloon, we were mindful of that. We want a payment plan that's worked out so that the debt, which is owed, is paid, but during this time where incomes are so drastically reduced, that there is flexibility in deferral. Mark.
Mayor Bowser, question for you. Given what we saw over the weekend at Fisherman's Wharf, coupled with what we heard from Dr. Bricks at the White House briefing warning that D.C. was going to be a hot spot in the coming days, this is not the time to go to a grocery store, are you considering any more ratcheting up of restrictions? And what are you doing to keep from what happened at Fisherman's Wharf from happening again at other places?
Well, thanks for that question. And we, as you know, have been very focused on food and food access and all of the delivery points for food access, including takeout and delivery at restaurants, making them essential, as well as our grocery stores essential, as well as all of the food markets have been deemed essential. And we had to close that market because the social distancing requirements weren't being met. We continue to work with the vendors at the fish market and the manager there to see if we can come to some kind of agreement where people will still have access to prepared foods. We haven't gotten there yet. But more than that, I have directed the food policy team to also look at all of the food markets across the city to make sure that we understand their plans to focus on essential food delivery, not other items, and making sure that there's a plan that people can get in and out of the market. We will add to that an enforcement component where we have a regular schedule of enforcing those markets.
Dr. Brick's comments?
I'm sorry, I didn't hear exactly the comment.
Well, she had said that she had listed specifically Washington, D.C. as an area of concern in the coming days for as being a hot spot.
Well, I told you that. I told you that on Friday. And I told the president that and Dr. Bricks that we are concerned that the next wave, if you will, if you consider New York City the first wave, in other cities that we've heard about, that D.C. could be in the second wave. Yes.
Is there some? I heard the president specifically mention D.C. yesterday. Did something happen? I mean, is D.C. getting something from FEMA or somebody else because of?
I've been solidly mentioning in all my communications with the White House and the federal staff our concern for the district and their responsibilities in the district. So I hope that message is going through. We continue to work with our federal partners at FEMA. Last week I talked to our regional director, and I think that's the emphasis that you hear. Dr. Nesbitt will be on an additional call today that she participates in with other big city health directors in the White House. So we want the message to get in everybody's head that we see a level of infection in our city, that if we aren't strict in our social distancing, the community spread will continue, and we will have more people succumb to illness and perhaps death. So it's very, very important that we're adhering strictly to those guidelines.
But it doesn't appear that there's anything specific that they've offered at this point.
We continue to work with them, Sam, on our supply request from the national stockpile. Another big request that all cities will have, but we're certainly concerned about, is how we will staff our surge beds, the new beds that we create as part of our surge capacity plan. Not only is getting the real estate in the physical space important, it's also important that we have supplies and people to make those beds functional. Yes?
Mayor, do you think the D.C. police are being proactive enough in trying to get people to separate out on the streets?
Let me just say this. It's everybody's individual responsibility to do what they know they need to do for themselves, their family, and this community. If we expect the police department to be able to make every single person do what they know they're supposed to do, we're going to be disappointed. What I have instructed the police to do is make sure that they have a message that when they see social gatherings, this is after we've closed parks. This is after we put police tape around playground equipment. This is after we've taken down basketball hoops and tennis courts. We still have people gathering in places where they know they shouldn't. And so we need the public's assistance here, and we also need business owners who are essential and have been deemed essential. If you're getting lax in how you're implementing your operations, you will be shut down. And that's what's key. Nobody wants the police department to be policing people about standing 6 feet apart. It's impractical in a lot of ways. But when situations where we found at the wharf or we may find at another market, they will be addressed.
Can I follow up? I don't know if you saw that over in, I believe it was Prince George's County, a grocery store worker died of COVID-19. On Friday, I talked with a union representing unionized workers for Giant and Safeway. And one of their biggest concerns was trying to get access to testing. Have you rethought that at all, to giving them access to the UMC testing site?
All D.C. residents, as you know, can call our hotline, and the hotline went up on Friday. I'll make sure that every resident has that information, and those workers who may have symptoms would be referred either from their doctor or through the hotline.
So you mentioned the issue of cutting $607 million out of the current year's budget. Like, put that into context that people can understand. I mean, how significant is that? How likely is it that programs that people rely on or like to see are going to be cut back on? I mean, people remember back in the day, the last recession, when Sunday hours at libraries were cut back and that sort of thing. I mean, so what's this going to look like to you?
Oh, I have some really good examples I can give you, and now I have to think of them off the top of my head, but. Let me give you an example of one of our agencies that I think is $600 million. FEMS. That's the, and somebody will correct me if I'm getting that wrong, but that's about FEMS. DCPS is just over $1 billion, so $600 million represents almost half or a little over half of the DCPS budget. We looked at some of the labor agreements, for example, that we put in place over the last 5 years, representing pay increases for our staff, about $600 million. So all of those, I could give you a lot more examples looking at my briefing, but those are real programs and services. Now, having said that, we think that we'll be at levels that we were spending in 2017. And we were doing fantastic, wonderful, transformational things in our city. And we're going to continue to do wonderful, transformational things in our city. But there will be less money. And there's more uncertainty about how fast our revenues come back. So everybody should just keep that in mind. Yes.
Yes.
A little bit more about the provision in the bill that will reduce the population at the jail and how many people you're expecting for it to reduce?
I'm not sure I can give you an estimate of how many people, but the good time credits, we've already expanded good time credits affecting the jail. What's in this bill, if I understand it correctly, affects those who are sentenced in the Bureau of Prisons. Now, they're district inmates, but they're in the Federal Bureau of Prisons, and so this is an effort to try to reduce that population. The compassionate release is focused, if I remember correctly, on older inmates. It would be inmates who've served a significant amount of time or they have an illness. There are various criteria that are set forth in the bill, but the idea is that somebody who's already been incarcerated for a long time or is very, very ill, what is being accomplished by continuing to hold them and they're being vulnerable to the COVID-19 virus?
That there were some parts of it that you maybe didn't agree with and some parts that the mayor was unenthusiastic about. What parts were those?
Well, it's a consensus bill, so we're all standing by the bill. That's the best answer you're going to get. But I wanted to make the point that there are some controversial issues or some issues about which there may be some disagreement publicly, and we're all standing together because I think that's what the most important message here is, that where we can provide help to residents, we're going to do it, and we're going to do it without the kind of political dialogue and disagreements that we can afford in normal times. It's important that we're on the same page, and so that's what the bill reflects. Yes.
Could you speak generally about the bill, about just the kind of relief you want to offer to residents and why it's so important now?
Well, I think my answer to your question would look at both bills, what was adopted on March 17th, that the mayor signed on March 17th, and what is in this bill. This bill is a little different than March 17th in that we're specifically addressing hospitals. We expect that those dollars will be reimbursed. This bill is different in that it does provide for short-term borrowing, and this is the first time in, I'm going to say, half a decade that the district has contemplated having to do short-term borrowing. But that's okay because we are tapping into our rainy day funds, and it's nothing more than a liquidity issue, not to minimize it, but we have the money. It's just a matter of whether we have the cash flow at the right time. Between the two bills, we've been doing our best to address relief for individuals, so that by far those individuals who have seen that their paychecks have been eliminated are being helped through unemployment insurance or the federal relief payments. There are some provisions in there that are intended to give additional comfort to individuals. The consumer protection, I talked about those today, but 2 weeks ago or 3 weeks ago, we had provisions in there to strengthen our law regarding and make it clear that our laws regarding price gouging and stockpiling by individuals, that those extended to the public health emergency. So we've been looking at consumer protections. That's important, but we're also very concerned about businesses because businesses are the employers. And the reason why there's so many individuals who are not getting paid or are out of work is because the businesses are shut down. So what can we do in terms of making sure that businesses that are shut down are less likely to go bankrupt? We want, when this is over, for businesses to come back and reopen and be healthy. So we've attended to that mostly in the legislation 2 weeks ago. I can tell you there was a provision that was in the draft. Nobody asked about it today, but was in the draft that circulated on Thursday and Friday that would have provided some additional relief to businesses. That was taken out because it has a fiscal cost to it, and we just don't have the money. It's a sort of a parallel to the issue of the undocumented. So I would say that those are the highlights of what we're trying to do to make sure that the government can function, consumers are protected, that individuals are helped, businesses are helped, and that our hospitals have what they need. Lou?
Yes, Mr. Chairman, for you and for the mayor, in terms of the budget for fiscal year 2021, is there any assessment made at this point about whether any new programs could be afforded, let alone whether or not there'll be major cuts? Because I have a specific question about one proposal.
I think it's too early to say. I have some thoughts in my head, but I'm not going to share them publicly because they're just my thoughts. I'm sure that the mayor has thoughts in her head, but I would say it's too early. We changed the deadline for the budget from March 19th to May 6th. And the chief financial officer, who's done some preliminary estimates of the revenue loss, that's the $607 million figure, we will have a better refined number before May 6th. I think everybody has to assume that this budget for next year and the budget for the current year is going to be much leaner. And so if folks are looking for additional programs, that's a hurdle. I'm not saying that that's an absolute no. I'm only speaking for myself. I would not say that's an absolute no, but it's really hard to think of where we're going to find funding for additional programs when we have to cut this year $600 million, and next year, I believe, about $600 million, and the following year, about $600 million. So people should be looking at, should be thinking of priorities. Sam?
Sir, can the CFO talk to us? I know he testified before your council.
I'd like him to talk. He can talk the numbers.
Okay. Well, he testified. You said it was $500 million, I guess, 2 or 3 weeks ago, right? That the loss was, and now it's risen to $6.
So as we've been looking at what is the impact on the economy, the sales tax losses from the business shutdowns, the impacts of unemployment on income taxes and business taxes, our estimate that we're going to refine and finalize for the budget on April 24th. The preliminary estimate we've given to the mayor, which she mentioned, was the $600 million range for the current year. And it's about that range for next year for the budget for 2021, about a $600 million reduction also under the current estimate. Now, we're getting data every day. We just got property taxes filed on March 31st. We just got sales taxes just came in. We're monitoring where the economic activity in the district is, and we'll continue to refine that. I can say that I don't see it getting better than $600 million. That's the current estimate. But we're working through that, and that's our best guess at the current time. On April 24th, that number that we put into our official letter will be the number that the government will balance to for the current year and through the financial planning period.
But it's worse than you estimated when you testified before the council a few weeks ago.
Yeah, if you look back on early February, mid-February, we were assuming we're going to get more revenue. So as we see the impacts of the shutdown, we see the how long it's going to last, the numbers will continue to change. I talked to the 25 largest cities on almost every other day basis, and every city in the country is having these same impacts and are coming up with similar estimates as to what we are.
Okay, a few more questions? Yes.
I'd like to ask you a question.
1, 2, 3. Yes, Mark.
Mayor, I suppose this would be for you. There was the two individuals who passed away at Hope Village, the halfway house. Now, again, this is under the control of Bureau of Prisons, so there's not much D.C. can do. But any thoughts on what's happening there and what D.C., if D.C. could do anything to kind of impress upon the federal government that they're concerned about people in their custody?
I am going to spend some time talking to the Congresswoman today and our public safety team with BOP and try to get more information out of that operator. So we will spend time doing that. I think I reported to you that we conducted our CIC, Corrections Information Council, conducted an inspection there think it was last week, that was really focused on making sure that all the supplies and some of the reports that we got could be confirmed. We, let me say, don't know exactly what has happened to those 2 residents, except I can say we were able to test the first resident for COVID, and he tested negative. We don't know the cause of his death at this time. And I don't know that we have the test results back for our second resident. Yes. Oh, I'm sorry. I called off, and then I'll come here. 1, 2. I think you were next, Mark.
Mayor Bowser, are you any closer to making a decision on public schools and whether when or if the public school year will resume? On Friday, when you gave your projections, that same day, D.C. Public Schools sent out notices to parents of seniors that they needed to pay their dues for prom and for graduation, and those were still going on as scheduled. Can you kind of square that circle for us, and what do you tell students and parents?
Well, the public schools, we will make a statement later, but it has more to do, Mark, with how in the city that we will be able to dial up more activity and when. And I like to talk to you all about that at some later date. But right now, we will announce the date that DC Public Schools returns as we have more information about the transmission of the infection in our city. Let me just say, our great hope is that kids can come back to school this school year. That is our great hope. And if the data on the ground indicate that that would be safe to do, then we will announce that. But we're not close to doing that at this point. And what's in the legislation that we asked the chairman to include was extending the public health emergency. Currently, the public health emergency would have ended on April the 24th. We've asked for an additional 45 days to extend the public health emergency. So right now, that is our marker for when we would be able to know for sure how we could dial up or dial up activity in our city. So before that date, we will be making some announcements, and likely before that, before DC Public Schools. Yes, you were next.
We have a reporter down at the fish market who says that he's been allowed and has reached an agreement with the city to reopen tomorrow. Can you add some clarity to that?
We haven't confirmed anything. I will make that decision, and I haven't made it. Yes.
So you just released the data by race. I'm wondering if you had any reactions, thoughts, or like analysis based on the data?
I'm going to leave the analysis to the medical professionals, but I think what you can see from the data is that this virus is affecting people all across our city. It is affecting men and women. People in various age groups are becoming infected as well. And you can see the percentages, and you can also see that there is some information that we don't have yet, and we're still trying to get it from the people who have tested positive. The information that's the most complete as it relates to race is for the people who've lost their lives. As I mentioned, we have 24 DC residents who've lost their lives. 8% of them are Asian, 58% are African American, 8% are Latino, 17% are non-Hispanic white, and 8% fall into another category.
The DC jail are saying that they aren't really receiving information about the coronavirus, aren't being kept aware about what's happening, and aren't really getting cleaning materials to clean their cells with. One said they're using their own shower towel to clean their cell with. So I'm wondering how are inmates there being informed about what's happening and kept informed?
You know, that's a good question. I don't know the answer to that. So let me circle back with the director about how news and information is being circulated among folks.
Cleaning supplies they're getting to clean their cells with?
I'll also have to confirm that. Yes.
Race data, does the disproportionate number of African American deaths concern you, or is there any deeper level of analysis?
All the deaths concern me. The number that we have is 58%, which is somewhat higher than not much, somewhat higher than the number of African Americans in our city. But I think that we can see in the data, and I don't have all the percentages right in front of me, about the number of infected people. We need to be very vigilant across all of our city in every demographic in Washington about staying home, listening to symptoms, because I think what we've seen across the country with the limited race data that we have is that African Americans are dying from this virus, it would appear, in greater numbers than other Americans.
Does the district have any testing data broken down by ward or race?
I'm sorry, I don't follow that question.
Among the people who've been tested, can you break that population down by ward and by race?
We have.
Has that been released?
By ward, the ward level data and the race level data have been released. Race level data for the first time today. The ward level data we've been releasing for several days, maybe a week. I'm sorry, I must be a misunderstanding.
Been tested, not who's been confirmed cases.
Oh, I got it. Let me double check on the negatives. Is that what you mean? On the negatives? Okay. I'm not sure if we've reported that. Let me check. Yes.
Getting back to the deaths in the district. You said 58% of them are African Americans. Can you speak more as to why that may be?
I don't. I'm gonna again make sure that our medical professionals are kind of analyzing the medical data. Yes. Sure. We're following a guide that HCEMA put out about critical and essential services during the COVID response, and construction is one of those services. Okay, I'm going to get down to a last couple. Yes, sir.
Medical marijuana to patients?
I don't think that's been discussed. Okay, Martin, you have the last. Okay, yes, sir.
So yeah, just back to this issue of social distancing and how it's being enforced and that sort of stuff. The other thing people pointed out after the Fisherman's Market was that places like Rock Creek Park are full of people because it's nice weather out and people want to get in their runs, which they can do, or want to get in their bike rides. But when you have a lot of people going there at once, you just have crowds. Like, what, if anything, can the city do to address that? Could that include, like we've asked before, shutting down other streets to kind of open up space for people? Have you guys given this any thought?
I'm not convinced by this open streets argument. I have to tell you, I think if we shut down a street, then you would be asking me, why are so many people on the street? So I just got to tell you, I'm not convinced by that. Okay, last question.
Some people also put out pictures of places like the DuPont Market yesterday, where there seemed to be, well, a number of people there. You've got the various markets around the city saying, what's the difference in this one and the fish market?
Earlier, I mentioned that I am appointing our folks at the Food Policy Council to address all of the open markets, the fish markets and the farmers markets, to make sure that we have a plan for all of them about how they're going to enforce social distancing and only procuring food items. And so,
question: the dirt bike boys and the moped boys and the ATV, they were out yesterday in force. Any reaction?
I don't have any reaction. Okay, you have the last one.
So the president last night mentioned about a federal medical station in D.C. and working with the mayor. Can you speak more to that?
I got to think that the president is referring to our discussions with the Army Corps of Engineers and how they will assist us with our medical surge capacity.
Something definite that's happening here?
As we briefed out on Friday, we're working with all of our hospital providers to ensure that they up their capacity by 125%. and we are going to assist them in doing that. Most of the providers have identified either space internal to their building on their campus, and others have requested some alternate care facility that might be on their campus or might be some other place in the city. Inclusive of that, some have requested our construction support. So that's where we are with those things. We will be looking at a what I call a mass care site, or frequently called an alternate care facility, and we will plan for that, for the number of beds that we need that can't be accommodated internal to a hospital or on the hospital's campus. Thank you, everybody.